Hi there, this is Dr. Paul and thank you for tuning into this video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about how we risk assess or risk categorize patients in my dental office. So the American Dental Association and even the American Academy of Pediatric Dentistry, they have certain forms with checklists that go over a couple of things. And basically it's all about collecting data from the patient, from the parent, from the caregiver. And once we collect the data, we quantify the data. And after we quantify the data, we basically give a risk assessment or a risk category. So the two risk categories are low and high. So let's talk about the low risk category. So low risk categories are patients who are not prone to getting decay, who have really smooth surfaces on their teeth, who have good quality saliva, who have terrific oral hygiene routines, and basically people who are fairly lucky and blessed that they don't have as many cavities popping up. High cavity assessment or a high cavity designation is for people on the other end of the spectrum who basically have a lot of cavities, have a lot of history of cavities, have tons of fillings and crowns and things like that. So the way we can actually collect this data is actually, by doing a complete examination of the mouth, but also by taking x-rays. So in my dental office, we're completely digital, which means we don't use analog x-rays. So the radiation amounts are barely minimum, to say the least, and we also use lead aprons with thyroid collars. We also have the use of two non-ionizing, which means non-radiation equipment, which scans your tooth with special lights that actually have a really high specificity of telling us if you've got cavities, either smooth cavities or cavities in between your teeth. So for people who are going through chemotherapy, for people who have a high gag reflex, for kids in general, we do use this equipment. It's called a CareView, which is actually a very, very well-respected diagnostic tool that aids us in finding out if you have cavities in between your teeth or around your teeth or even around orthodontic brackets. So once we collect all this data, we go through a checklist and then we give this person or this patient or this child a low or a high risk category designation. So, I'll give you an example. If a child comes in and they only have their front couple of teeth, these teeth are smooth, they don't have as many pits and fissures, and for now they could be classified as low risk. But as soon as they get their molars that have tons of pits and grooves, they could start getting cavities and they now become high risk. So just because you have a low risk designation, that doesn't mean we don't periodically keep assessing your teeth to make sure that you're always staying under low risk, or if you are under high risk, we're not making sure that we don't slip off, constantly keep checking that you're still high risk or you're actually downgrading to a low risk. So it's a very active procedure, because the truth of the matter, or the actuality, is dental decay can never be eradicated, or dental disease can never be eradicated. It can only be controlled. Now, by that logic, if you are someone with low decay risk, you're not given the same amount of x-rays per year or the same amount of fluoride varnishes or fluoride trays, or you don't need to come in as regularly for cleanings or checkups per year as someone with a high risk. So we also customize our treatment depending on what kind of risk factors or categories you have. Now, this whole way of addressing things is called CAMBRA. CAMBRA basically stands for Caries Management or Decay Management by Risk Factor Association. So that is something that we take pride in our office that we do, because at the end of the day, if we had a cookie cutter model of taking care of each and every patient, we would love to implement that because it's a generic formula. But that's not the case. Everyone has different needs, everyone has different genetics. But at the end of the day, if you come to see us as dental professionals, we need to make sure that we take care of you. And it's all about making sure that you don't go through multiple fillings, root canals, crowns, bridges, implants, and all this stuff in the future. It's 2020 right now, and if you actually proactively are able to take care of your teeth, the whole fact of the matter is the big claims or the dental profession as such, where you have a big amount of copay to pay out for all the elective work that's not covered by dental insurances. all the stuff can be eliminated. It just takes a very proactive approach in achieving that goal. Thank you so much for watching, and in the next video we'll talk about different varnishes and lacquers and different kinds of creams that we use in our dental office to contain a lot of these pathogens, and that way you will know what we can do for you if you ever choose to let us be your dental office. Thanks for watching.